Well, when I would ask people that were in favor of this COVID shot, do you really think God made your cells to produce COVID virus for years or indefinitely or even for months? I don't think my cells need to produce that. I think you could give me a COVID vaccine that's more traditional and let me respond to it. Cats that can cause FIP, when they tried to vaccinate cats with coronavirus vaccines, the vaccinated cats died more than the unvaccinated cats. So coronavirus is just a weird virus, and it depends upon the species of human or pet we're dealing with.
Your organization has achieved a significant dent in vaccine mandates.
We didn't do the science. We didn't do the clinical trials. We didn't do the post-safety. But one thing we know it's rare.
Hello, and welcome to another episode of Shot Callers. I am Carrie Bigford, Outreach Director with Texans for Vaccine Choice. And today we have a very exciting guest, Dr. Shawn Messonnier, also known as the Natural Vet, who is dedicated to promoting holistic wellness for pets and their owners. Dr. Messonnier opened Paws and Claws Animal Hospital and Holistic Pet Center way back in 1991. His special interests include holistic and functional medicine, exotic pets, dermatology, cancer, and internal medicine. Dr. Shawn is a well-known speaker and author. In addition to serving his clients, he has written numerous veterinary and pet publications, including Animal Wellness, Body and Soul, a whole bunch of other ones. He's also written several books, including the Natural Health Bible for Dogs and Cats, which I actually happen to have. I didn't realize it was this Dr. Shawn. The Allergy Solution for Dogs, The Natural Vet's Guide to Preventing and Treating Arthritis in Dogs and Cats, The Natural Vet's Guide to Preventing and Treating Cancer in Dogs, 8 Weeks to a Healthy Dog, Breast Choices for the Best Chances. So many incredible books, all geared towards holistic veterinary care. I am so excited to have Dr. Shawn here today. Thank you for joining us today.
Thank you, Karen. I'm looking forward to spending some time with you and your listeners.
Yes. So tell me about how the medical liberty topic interplays with veterinary medicine.
Well, for me, it's pretty much the same thing. Whether you're talking about yourself, your children, or your pet, I really think that we all need to have informed consent and learn as much as we can. Unfortunately, a lot of the times we have to learn on our own now to be better informed, but we should hopefully search for and encourage our doctors and our nurses to try to change the medical system, veterinary and human, kind of the way it was when I was growing up, where you actually spend time with the doctor, you spend time with the veterinarian. You just didn't rush in and out, get some vaccines and go home, and that was considered healthcare. So I think, especially now that we have RFK Jr. Leading the charge at the FDA and the health initiative, trying at least to put that conversation back in, I think that's a good starting point for us to grow and learn.
So I know that human medical doctors, they face a lot of pressure to vaccinate all of their patients on schedule, to the point where they risk their in-network insurance status if they fail to meet those metrics. Most veterinary medicine is mostly cash pay. Is there that same kind of pressure that's happening in the veterinary world?
There's not pressure from the insurance companies. I guess other than I would say there's an implied pressure from the perspective of, if you have a disease like distemper or parvo, where we know vaccines can be done safe and effectively. Unfortunately, we do way too many of them. But if you're not vaccinating your pet for what are considered vaccine preventable diseases, there could be some liability possibly on the part of the veterinarian, but there could also be a lack of coverage for the pet owners. As we go through our conversation, we'll talk about some of the differences between people vaccines and pet vaccines. But really, there's not pressure per se to vaccinate, other than if veterinarians just want to do that as a source of income, or they're working for a corporation that requires that. I never felt pressure when I owned my own practice, or even when I was owned by somebody else. But they were very good about allowing us the freedom to practice as we saw fit, as long as we were doing, obviously, the correct standard of care.
Right. Awesome. So you had mentioned distemper and parvo as being vaccines that are worthwhile. Tell me some of the differences between the human vaccines and the veterinary ones. I mean, I know the obvious USDA guidance, all of that.
So, I think for me, when I look at this, the first thing I'll just present to the people who are watching is to keep in mind there's a big difference between vaccination and immunization. Vaccination simply means the vaccine was given. It has nothing to do with your immune response. Immunization means that you responded immunologically to the vaccine. And if you respond correctly immunologically, person or pet, then you should be protected from that disease. Again, we're giving a generic answer here. It all depends upon the disease and the vaccine. So the fact that a person or pet's been vaccinated to me doesn't mean anything unless I know the vaccine took and is effective. When I look at vaccines, and I get a lot of pet owners that are coming to see me that obviously don't vaccinate their kids, don't get vaccines themselves, or at least limit and spread out the vaccines. And I try to explain to them that for the most part, the diseases in people for which we have vaccines, for the most part, are typically not very fatal diseases. They don't have a high mortality. That's different from our pet vaccines and diseases. If you have a dog, for example, that gets distemper, that's considered 100% mortality disease. That's not totally true, but let's just say it's 100% fatal. Same with rabies. Parvo, if you have thousands of dollars for emergency treatment for several days, probably won't be fatal. If you don't have that kind of money, you might be thinking of euthanasia. Similar for some of the cat diseases. So for me, I would encourage my clients to consider vaccinating their pets, but to do so in a strategic, logical way, and then follow up with blood titer testing to prove they were not only vaccinated, but immunized, that the vaccine actually worked. And that titer testing allowed me to not vaccinate pets very often. After they had very limited vaccines as puppies and kittens, with the exception of rabies vaccine we can talk about in a bit, I rarely vaccinated adult pets because their titers told me they were still immunized and vaccination wasn't going to make a difference from a positive perspective and might have set them up for cancers or other bad diseases.
That's fascinating. We have a lot of feedback from pet owners who say that one of the barriers to getting titers, especially for like rabies or any of the vaccines, is that drawing titers is so much more expensive than getting a vaccine. Do you know why that is? Because normally the feedback we get is that they're being quoted upwards of $350 and more to run titers for each vaccine.
Right. Okay. So I'll come to rabies again a little bit later because rabies is a totally different
a whole different topic. Yeah.
There's a legal part as well as a medical part. All right. So titer testing is very safe. It is very effective. It's used all the time to approve vaccines. So we know that it works. It's also approved from the rabies perspective. If your pet's going overseas, you have to have a rabies titer to prove they're protected. So we know that titers work. They're very effective. The cost really comes down to who's running the titer test. In my practice, we ran the titers in our office, in our hospital. For the dogs, we sent them to a diagnostic lab for cats. Both places, my office and the diagnostic lab, were relatively inexpensive. We could do a complete set of titers excluding rabies for dogs and cats for about $100 to $150. Now, because most veterinarians don't understand titers, don't agree with titers, don't like titers, don't run titers, they don't do them in their offices in their hospitals. So if they send them to a non-diagnostic lab, a lab that runs other blood tests, but doesn't run titer tests very often, you're correct. They're going to run $300 to $400 in some cases per titer, at least for the whole set. So if you can find a veterinarian, which is really hard to do, that does titers in his office or uses a diagnostic lab, you'll decrease the cost by 60 or 70%. The problem is if you're not a veterinarian like myself that did titers all the time, every day, you're probably not going to go to the trouble of learning to do titers in your office for those one or two clients that come into your office and just want titers done. It's just not worth your effort. But then the titers would cost multiple hundreds of dollars of use that you've mentioned.
I've always found it fascinating when medical providers express discontent about wanting to check titers, because that is the diagnostic tool to make sure that you've seroconverted and had an immunological response to a vaccine. Because you're right, like people and animals are what's considered a non-responder sometimes, meaning you can vaccinate them over and over and over again, and they'll never have an immunological response. So I'm always fascinated when people push back on the titers because, like, shouldn't that validate that your vaccine worked, you know?
Absolutely. I mean, after we would vaccinate a pet, if it needed a vaccine, we would do a titer test 3 to 4 weeks later to make sure that one vaccine worked. It didn't need 5 vaccines or maybe no vaccines because it was a non-responder, as you mentioned. The other thing is interesting. If you look at human medicine with the HPV vaccine, Gardasil and other ones like that, you're supposed to run a titer before you vaccinate because so many people, women especially, because it's more normal in women than in men, but so many of us have been exposed to human papillomavirus to where all of us are quote unquote infected. We just rarely would ever get sick. Our immune systems would take care of that. But if you are positive for HPV and then you get a vaccine, you have much more danger of cancer and other things happening. So I think titer testing is great. I know in my own patients, when I was in private practice that hadn't received vaccines for many years, if they came in for their titers, sometimes their titers, especially dogs, would be higher, say for distemper and parvo. And what that told me is that they didn't have a vaccine. They were exposed to the disease out on a walk. Their bodies responded correctly. Their titer tests went higher. And I knew just the titers were working and their immune systems were working. They didn't need another vaccines because their bodies responded the correct way from prior vaccines when they were puppies and kittens.
That's awesome. I mean, it's just the whole titer aspect is fascinating. And the pushback on it is just astounding because if you quote unquote believe in vaccines, there should be no pushback to validating their efficacy. And then, of course, that issue of non-responders, I meet people all the time that doubt that reality, but not everyone responds to vaccination, whether you're a human or a pet. When we have no solutions for those people as we look at vaccine mandates, whether it's the rabies mandate for pets in Texas, or whether it's, a person going through nursing school who's a non-responder, what do you suggest we do with these non-responding people and pets?
Okay. Well, and I'll come back to another topic that I don't forget too. So the non-responders, to be honest with you, I never had a patient that was a non-responder. And that's, I don't think they're super common in pets. I'm not sure how common they are in people, but we'll say it's a very small percentage. Because the titer test is the cheapest, easiest way to measure one part of the immune system, the antibodies, we also have to keep in mind that we have cell-mediated immunity through our T cells. Those are not easy to test for. So even if you had a pet or a person who's a non-responder, that doesn't mean that patient's going to die if you're exposed to an infectious disease. It just means we can't measure one part, one half of the immune system. And to keep vaccinating would be stupid because they're never going to respond with a titer. That doesn't make any sense. And you can do a lot of damage, we believe, with over-vaccinating, with immune system damage. We saw a lot of the side effects with COVID, HPV, other things. So we don't want to do that. I would just say, if you can find veterinarians that do titers, and they're few and far between, do them. I know as I retired last month, a lot of my clients were asking me, well, where are we going to go now? My answer was, I don't know where to send you. I'm still available for phone consultations to help you. If you get a new diagnosis, if you follow up with your blood test, you want my help. If you need to refill supplements, that's fine. Otherwise, try to find vets that are open to titers. Even if they cost more, maybe don't do them every year, even though that was my ideal to do it every year. Maybe spread it out every few years, especially if the titer is a higher titer. It's probably still going to be present that following year. Do what you can. I'll tell you just a story. As I was retiring from practice, I was owned by a corporation. And I was trying to find other veterinarians that would see my clients, knowing my clientele was very particular. They don't do a lot of vaccines for their pets. They rarely do any at all for their families. And I would talk to veterinarians and say, look, would you accept that? Would you allow my patients to come there? Could they get care? And they're like, well, if they don't follow our vaccination protocol, no, they're not coming in our hospital. Or maybe they can come in if they're sick, but if they need a spay or a neuter or dental cleaning or surgery, they have to have all these vaccines we have, and we're not going to talk about it otherwise. And I would even say, well, look, would you accept a titer test? Because that's a proven test. Nope, we're not going to accept titers. We're not going to help your patients. It's like, okay. And what's so funny is I called the vet the other day up here in Melissa, close to my house, because my sister-in-law was asking about this particular clinic. And I called up, didn't tell him who I was, and was just asking, what do you do as far as vaccinations? What do your doctors accept? Do you do titers? Well, they will do titers, although they'd rather not. They're going to be kind of expensive. But they told me, okay, if you came in with a pet, we would see your pet. But if it had to be dropped off for surgery or dropped off for an x-ray or something, We're going to do all the vaccines we have in our refrigerator before we admit them to the hospital. And again, I didn't want to get into an argument, but I'd love to ask that vet, you do understand if you vaccinate my pet that moment and then take them to the back where the other animals are, the vaccines don't work in 5 seconds. Even if they've been vaccinated before, it takes about 5 to 7 days to boost their titers to higher than they were when they came in the door. And if you did the titer tests, they were probably adequate. So if you're getting your pets vaccinated, then they're being boarded, you're not gaining anything. The pet doesn't respond to the vaccine immediately. Even bordetella in the nose would take about 2 to 3 days. So the vets think that they're doing something, but they're not, except making money. And I know from the human perspective, I've listened to a lot of pediatricians that Children's Health Defense has interviewed. And they've all said, look, when we gave up vaccines, we were losing a ton of money because we're reimbursed by the insurance companies to vaccinate. We don't have that problem in veterinary medicine. The insurance company doesn't deal with anything I do. So there's not a standard where I make money for vaccinations other than I just make it, that's what I would charge. But I would make the same amount doing titers and not hurt my patients. So that's a long answer to your question, but I think people need to understand all these things. And maybe if you can do it in a non-combative way, ask the doctor, well, why would I need to vaccinate my pet right before boarding when they don't work that quickly? What's the purpose of that? And there is no answer other than really from a liability perspective. If somebody got sick, if another pet died, at least you could prove to someone, well, they were all vaccinated. But it still doesn't matter from a medical perspective.
I mean, for humans, the CDC defines vaccinated as no less than 14 days after the last dose in a series.
Right.
So you can have 2 MMRs and have your second MMR 12 days ago and be classified as unvaccinated.
Right, because the vaccine doesn't work that quickly.
It doesn't work.
I'm just saying 2 weeks is kind of a cutoff point that kind of captures most people and most pets. Right.
Right. But it's not instantaneous.
And we saw that with COVID. People were getting COVID shots. They would get sick within that 2-week period. Well, they weren't vaccinated. Well, of course they were. But, there were just
they weren't vaccine protected.
Right. Correct.
Right. Yeah, there's a big difference between, just like you said, being vaccinated and being immunized. Those are not synonyms.
No.
And I think it's amazing just the pushback on titers. Why would you want to revaccinate my pet and be unsure of their protection when you could run a titers check and be sure of their protection or lack thereof? It's just amazing
I don't understand too, from an economic perspective, not that we want to do things to rip people off, because that's not the point, because titers are not a rip off. They're actually a replacement for something your pet doesn't need. But, I love to talk to vets and say, well, you say you're against titers, but we have all this science showing they work. That's how vaccines get approved.
Yeah.
Why would you turn down $300, $400 of income for your practice? If your client wants to do it, if for no other reason, make the money. I mean, that's just stupid from a business perspective.
What are their answers?
I don't really, it's just they don't believe in them. They don't agree with them. And truthfully, if you're not doing titer testing regularly, you wouldn't know how to interpret them anyway, unless you do it with some regularity.
Yeah.
But the good news is, if you don't know how to interpret them, you can call the lab up that ran them. They'll tell you what the interpretation is. You don't have to know anything anymore to be a doctor. I hate to say that, but we've got, if I need a specialist, I can just call up a lab and ask questions. I don't have to go back and learn everything myself. I mean, I should, but I don't have to.
Yeah. The contradiction between meeting people that say they believe in vaccines, but they don't believe in titers is just amazing. Titers are literally the validation that vaccines are working. And so it's interesting because I encounter this with humans all the time. They have that same duality resistance to I believe in vaccines, but I'm not going to verify that they're working for me.
I know they're just, I think so many people in COVID showed how fearful people are. And we just, whatever the doctor says, we just want to argue about it or talk about it. Just but don't you want to know if you're doing something that's good or bad? It's like I told my friends, if you want to get 100 COVID shots, I don't care. Right. But let's at least be able to have a conversation that maybe that's not necessary. Maybe they're harmful. Maybe they're going to kill you.
Right.
And if your COVID shot or flu shot or whatever protects you, why do you care if I have a flu shot or a COVID shot? You're protected, right? Oh, they don't work all the time. So you want me to get a shot that need not work to protect you because your shot didn't work?
Yep.
I mean, is there any logic with this?
No. And also, most of the vaccines on the human schedule don't prevent transmission or infection. They only provide a benefit for the recipient alone. So that whole argument of you have to vaccinate to protect me doesn't even work, because that vaccine will only ever, at the best case scenario, provide personal protection for the recipient. It doesn't have anything to do with anyone else.
I know. So again, they don't understand. It's but the vaccine doesn't prevent you from getting infected.
Yeah. People have a hard time hearing it. So you had mentioned distemper and parvo as vaccines that were definitely worth considering. Yes. Are there vaccines for pets that aren't worth considering, that just are too dangerous or too ineffective?
Okay. I also would mention for cats, the panleukopenia virus, the calicium virus, and the herpes virus. Those are important things. Unfortunately, a lot of times kittens and puppies, kittens particularly, as I'm talking about cats, pick up herpes virus before they're old enough to get a vaccine. We may not know that, because herpes, like in people, can just stay in your system forever until it comes up due to stress or something. But as far as vaccines that are probably not necessary, a lot of this stuff has to do too with the exposure potential. If I have a 17-year-old dog or cat that doesn't leave my house, that's lucky to have made it to 17, I don't think they need any vaccines, because they're not doing any good. And they probably have protection from prior vaccines. I would do Bordetella for dogs. Usually when they're puppies, one time, either intranasal or oral. I don't like the injectable vaccine. And then usually I wouldn't do it again, although I wouldn't force owners to do it. And if they mention their pets are never going to board or get groomed, is it really necessary? Probably not. Bordetella is basically get cold. Certainly it can be fatal, but it shouldn't be. It should just be a bad cold. So I would say that's what I consider non-essential. Coronavirus is just in dogs or puppies, it causes mild diarrhea. You're never going to know if your dog or your puppy has coronavirus, so it's a useless vaccine. Leptospirosis is interesting. So leptospirosis has started showing more cases of that in the area. It's a bacterial disease caused by Leptospira. There are many different strains of it. The vaccine only covers about 8 strains. So number one, your pet can still get leptospirosis. It just shouldn't get the most common strains. It's transmitted by rodent urine. So unless your pet has a lot of rodents around the house, you live in a lake, or it's a hunting dog, probably not a high exposure. The problem with the lepto vaccine too, it's the one I've seen that causes more reactions, including serious reactions, especially in little dogs, chihuahuas, pugs, little tiny dogs. So I would have a conversation with my clients. Leptospirosis is a real disease. I've seen dogs die of it. If your dog gets it, it usually is going to cause a kidney or liver problem, and it's untreated, or if you don't seek veterinary care right away, it can be very expensive to treat, like thousands of dollars in ICU. It's also something we can catch from pets because it's spread in urine. So when I have this conversation with my clients, most people would decide not to vaccinate. I'd say, okay, look, if your pet ever gets sick, not feeling good, lethargic, not wanting to eat, vomiting, diarrhea, urinating too much, urinating too little, just let the doctor, whether it's me or the emergency clinic, know, hey, could you at least check my pet for lepto? It's a fairly simple test to do. And if there's any suspicion of leptospirosis, you can start antibiotic therapy right away while waiting for the lepto test. We don't like to overuse antibiotics, but in a case like this, you could save the pet's life. And if we're wrong, just drop the antibiotic a few days later. Additionally, if you vaccinate for lepto, it does screw up the lepto titer test. So if I'm running lepto titers as a diagnostic test, I can't really tell if your pet's positive from the disease or from the vaccine. But there are other tests I can do that would not be a problem.
Right.
The problem with lepto too is people ask, okay, if I want to do titers, how long do the titers last? And I don't know a good answer for that. I've talked to some immunologists at A&M, and they're like, well, we don't really know. So because it's a different kind of disease, if you're going to vaccinate for lepto, you really should vaccinate probably every year. But you also have that little risk of allergic reactions, of immune reactions, where your pet might start attacking its blood cells. I've seen that. And that can be worse than the disease. So it's one of those things owners just need to understand, maybe do some research, check the lifestyle. Lyme's vaccine. I've never seen Lyme's vaccine. I know if you go up northeast, it's way more common there. I know a lot of my clients have had chronic Lyme's disease. I've just never diagnosed that. So that's not a disease I worry about here, but I will test dogs for it if they're showing clinical signs, and I might be concerned about that.
Okay. You mentioned that smaller dogs react stronger more often to vaccines. Is that because, just like with humans, the dosages are one size fits all, where like a 300-pound man gets the same vaccine as like a 1-year-old? Is that the same for dogs? Yeah. Like a 5-pound Chihuahua gets the same as a Great Dane?
Right. And I'm glad you remember to ask me about this, because a lot of my clients would do lower doses of vaccine. So let's talk about that. That's also another issue. So when you look at the vaccine, if you were going to have truly an anaphylactic, life-threatening, immediate allergic reaction, whether you get the whole 1 mil or a drop of it really isn't going to matter. It's just like if you're allergic to bee stings, one will kill you. You don't need 100 bee stings. So I'm not making the vaccine any safer from an anaphylactic reaction to give less. I do believe, though, because there's less particles, less preservatives. We use thimerosal-free vaccines, but there still is a preservative in there. It's usually aluminum or something else, depending on the vaccine. So the problem is that if you give less than the required amount, then we don't have testing from the vaccine companies to prove that dose is fine. And technically, doctors are not supposed to do that, because we could get into issues with liability. So I would have this conversation with owners and say, look, I can't force you to do the full dose. I agree with you medically. That's stupid to do the same dose for your 3-pound Chihuahua or 2-pound kitten or 150-pound Great Dane. If you want to do a lower amount, you have to sign a liability release. We've talked about this. You're not holding me liable. I talked to the state board. They said, look, if that's all you can do, that's all you can do. We'd rather have them have some vaccine than the correct full amount. But the interesting thing, again, is I would do those lower doses of vaccines with the owners signing the form, do their titer tests, and lo and behold, the titers were fine. It was the same as if I had done the dose. So you don't need a whole lot to boost them. The initial vaccine, I would still prefer to do the full amount, but I would do the lower amount. And again, the titer tests were totally normal. The problem, again, people listening and watching to this, you're probably not going to find any veterinarians out there that are going to do a lower dose of the vaccine. Which
I've never heard of that before, as even being an option. Yeah.
I mean, again, there's some legal issues. You have to, deal with the state board and all. But I could always prove the pet was still protected, and none of them ever got sick. Everything was fine. It was no big deal. But, I do understand people's desires. I think the lower dose, because I've proven by the titer tests they're safe and effective. I think we just need to get more rational on things. I will mention something there, because I mentioned about adjuvants. So adjuvants are chemicals, usually aluminum, thimerosal, other things that are added to vaccines to produce a stronger immune response. So there is a positive philosophy behind them. There's still a lot of adjuvant in there, so the lower dose you would give, the better. Yeah. There are some non-adjuvanted vaccines, and for cat owners, this is important to understand, because some of the manufacturers of vaccines are promoting and advertising we have non-adjuvanted vaccines. Why is that a big deal? Well, in cats at least, probably dogs, and I know this has happened in ferrets very rarely, if the cat is genetically predisposed to excessive inflammation at the site of an injection, usually a vaccine, but it could be anything injected, and the cat's genetically predisposed to have an immune response that's greater from the inflammatory side that persists. We know that persistent inflammation is a cause of cancer. And so cats can develop what are called vaccine-induced, or really injection site, but vaccine-induced sarcomas, which is an aggressive cancer typically associated with a rabies vaccine and feline leukemia vaccine, but any vaccine can do this. So the philosophy came about, and the thought process was, well, what if we did non-adjuvanted vaccines? At least we don't have the adjuvant causing this excessive inflammatory response that could cause cancer. Great idea. The problem is the vaccines we have now that are not adjuvanted are all mRNA vaccines. So you still have the problem with the mRNA that I don't like for the COVID shots. So, I'm not against mRNA technology in general, because it's a fascinating, wonderful technology. And I think if you were born with a genetic defect, or we had to give you, say, an insulin gene to maybe cure you, I think the slight risk of something going wrong could be worth curing you of a lifelong, potentially fatal disease. But when we're talking about vaccinations, we all know the way mRNA vaccines work. There's that problem with it. And even though the vaccine manufacturers told me in a meeting I went to that there's a kill switch inside the mRNA that shuts everything down and stops the mRNA and it stops reproducing all this feline virus in the body, I just don't believe that. I don't think they're lying.
Yeah.
I just don't believe, I just don't want to trust that this kill switch is going to work. And I don't think we have enough proof of it. So unfortunately, cat owners need to decide, do you want the mRNA non-adjuvanted vaccine and maybe not have cancer or at least lower the risk, or take the tiny risk with the vaccine with the adjuvant in it to cause cancer. Now, what I will say is, again, if you're doing titer testing, the chance of you over-vaccinating your cat and having this problem is almost zero. And over the last 20 years, since I became more holistic and really decreased our vaccines, the only vaccines for comas I ever saw were coming from other practices where annual or three-year vaccines were done on a regular basis, and the cats and dogs were getting way over-vaccinated. So unfortunately, again, finding veterinarians that understand this and are willing to work with you is like finding pediatricians. Although I believe from talking with people of the Texans vaccine, your vaccine for choice, there are more and more pediatricians that are open.
There are more and more.
And which is good because my daughter's getting married soon. And if she does get pregnant, I'll use that resource too. I don't know. I think I'm the only vet on your site, maybe at least in this area.
You are the only vet on our site right now. Yeah.
But at least, people can reach out to me if they need a consult on a sick pet or want to look at wellness supplements. And I can at least talk with them about some of this science and hopefully they can find someone somewhat open to this. But it's going to be a lot of research on their own part.
Yeah. I mean, you are a very special man, and I'm so thankful that you were out there practicing for so long. And I share your skepticism about the mRNA kill switch because they said the same thing about the COVID vaccines. And yet research has shown like even 700 days post-vaccination, you're still creating spike protein, which was cytotoxic that they never even thought to see if the protein your body was making was harming you or not,
Well, and I would ask people that were in favor of this COVID shot, do you really think God made your cells to produce COVID virus for years or indefinitely or even for months? I mean, I don't think my cells need to produce that. I think you could give me a COVID vaccine that's more traditional and let me respond to it. Of course, the problem was coronavirus is really weird because like I said, in puppies, it causes no big deal. Pigs, it'll kill pigs very quickly, especially piglets. Cats, it can cause FIP. And when they tried to vaccinate cats with coronavirus vaccines, excuse me, the vaccinated cats died more than the unvaccinated cats. So coronavirus is just a weird virus and it depends upon the species of human or pet we're dealing with.
That's interesting. I hadn't heard that before. Speaking of pets' death, I know that more and more veterinarians are being pressured to go for euthanasia with their pets when they're sick versus offering a myriad of different treatment ideas. I don't know if that's like a cost prohibitive mechanism or just a lack of creativity or drive, but I have noticed that we get more feedback about veterinarians, being euthanasia happy.
Yeah. And, I could tell you so many stories about my patients that had gone to emergency clinics and it was recommended euthanize the pet and they came to me the next day and their pets lived for years. But I don't have an answer for you for that because I've never talked to vets about that. So I'm just guessing here. Number one is they may decide, well, your pet's kind of old and he's had a good life, as we're seeing with, states and countries that have euthanasia laws and end of life laws where, you save money to kill the person rather than put them on Medicare or health insurance and all that. So I think economics could be part of it. But again, I think the vets are judging the owners. Well, I don't know if you can afford this. And if it were my dog or cat, I'm not spending $10,000 for a 15-year-old pet. But again, we should let owners have options.
Right.
And I really don't think in most emergent situations at an emergency clinic where the doctor knows nothing about your pet, or if you go to the emergency clinic yourself, they don't know anything about you. We don't have a standardized database we can all tap into. So unless your pet has, for an example, we'll pick on dogs and cats, say hemangiosarcoma of the spleen or liver, where the pet's bleeding out, and you have a choice of a $10,000 surgery and follow-up care, or should we euthanize your pet now? And the owner's like, well, okay, if you're sure of the diagnosis, the belly's filling up with blood, I can't afford that. That's a different issue. But for pets that may seem really sick, but could we give them a chance and get them to the next day and let their regular doctors take over? I'm just so glad my patients, I tell my clients all the time, if you have to go to the emergency clinic, unless it's truly your pet's hit by a car, their guts are hanging out everywhere, please don't opt for euthanasia. Give me at least a chance to talk with you and see if you can afford something to help your pet. And like I said, there's just story after story I know of in my own practice where these pets are, oh, your pet's probably got a brain tumor. They didn't have a brain tumor at all. They had a mini stroke and they were fine. Those kinds of stories is just like, no, don't give up on that.
Yeah. That's so sad because, like, for me, my dogs are my fur babies. Like, I am obsessed with these dogs. I love them so much. They're laying in my office right now because they go everywhere with me. Like, it would be heartbreaking to have someone just callously be like, oh, we gotta euthanize it. Like, we're not going to make any effort to save it. And then to find out later that a course of antibiotics or something could have made the difference for my pet, like,
Sure. Now,
yeah.
while you brought this up, though, it made me think of something else because, again, my clients are very holistic, which means they really didn't want to use a lot of drugs, a lot of vaccines. One thing I would encourage people, if you tend to be more naturopathic, and I'm going to say anti-drug and all of that, don't be so anti-drug you don't let us save your pet that needs a drug. If I have a pet with cancer, many of them didn't need chemotherapy, but some really did. And I would have to sometimes struggle to convince owners, I know you're worried about that, but you really should consider chemo because it can save your pet's life. Or if they need a steroid shot or an antibiotic. Now, again, vets use these drugs way too often. But if it's truly something, I would tell my clients, look, you know that I don't reach for drugs as the first thing. If I'm telling you your pet needs a steroid shot for its itching or an antibiotic for this infection, I'm coming from a good place. I'm not just pushing you to use drugs. I've got all these other herbs that work most of the time. This time your pet needs both. So be open to that. But it doesn't hurt to question things. I rarely needed antibiotics because my pets were healthy. They weren't getting vaccines. They were on good diets. They were taking supplements. And oftentimes I had an herb or homeopathic that had antibiotic-like activity for minor infections. I never used antibiotics at all. And my patients got just as well as everybody else that was using or overusing all these antibiotics, causing antibiotic resistance, which messes everything up for the rest of us that need antibiotics sometimes to save our lives.
Yeah. And it messes up your gut flora, which is a huge part of your immune system.
Sure. Right.
So speaking of supplements, like, what are some good supplements that, like, cat and dog owners can just mix in with their animals' food or give to them to kind of help them with longevity and overall health? Do you have any recommendations?
Okay. Yeah. So, as you know, I just started my new website to reflect my consulting business. On the website, I appreciate you said you post for us. There are some supplements on there. The best way to go through this, though, because I don't have everything posted on there, if people want to do a consult with me, a wellness consult to ask about specific supplements that may benefit their pet at that stage of life or the breed, maybe needs something different, that'd be great to do. But in general, I think all pets, and I would start even puppies and kittens on an omega-3 fatty acid, usually a fish oil or krill oil spine, something like that. A good multivitamin, mineral, immune supporting supplement I think is good. And then I think a good enzyme probiotic combination to help the gut, to help the immune system, to help with digestion. After that, it really would depend upon, assuming the pet was still healthy and not sick, I would do things for, if an owner, for example, say wanted to try to delay the onset of joint disease, we do a good joint supplement, maybe a glucosamine chondroitin MSM HA supplement. It was a larger breed of dog that we know is going to develop arthritis and joint disease earlier, probably starting them earlier in life. If it was a middle-aged to older dog or cat, maybe something for brain support. And we have all sorts of different products, different names. But those are things generically I would use depending upon the stage of life, the concerns of the owner, the breed, the activity level, et cetera. And then currently on my website, the supplements I have on there are all my own supplements that I formulated with two different Eastern medicine Chinese herbal pharmacists. Those are more for disease, cancer, allergies, epilepsy, some joint issues too. But those would be more replacements for or additions to medications that a pet might be taking, say for allergies, or we mentioned bowel disease, IBD, urinary disease, with the goal being if the pet's mildly affected, we won't even use drugs, we'll just use these types of supplements. If they're already on drugs for seizures, for allergies, for example, I mentioned allergies because we see it so much, or cancer, can we use these supplements to slowly wean the pet down on the dose or totally off of the drugs? And I would tell you again, going back to my practice, I look at the generic pet with any disease you want, maybe except cancer, allergies, epilepsy, bowel disease, whatever. I would say that probably only 5 to 10% of those pets would get drugs. And even then, it would not be a regular thing. It'd be a really rare case where I had a pet on drugs for life. And usually it would be at a much lower dosage because we would be doing a lot of supplements to have drug-like effects, but don't have the side effects some of the drugs could exhibit.
Right.
So I think this natural approach is good whether your pet may need drugs or not. Or if you have diseases, so many of my clients would tell me their stories. They had chronic Lyme disease, they had rheumatoid arthritis, they had whatever, and they whipped it naturally, or they needed drugs for a while and now they're on supplements. They're doing great. And they're just controlling things with the supplements. So all of this stuff works. We've got tons of science behind it. And for me, the best science is I can see it works or it doesn't work. Veterinarians that would say, well, these herbs don't do anything. Well, tell the dog that's no longer itching that. Tell the cat that's no longer seizing that, because they think it works and their owners think it works. So I think it works. It's not just coincidence.
Yeah. Yeah. I mean, it's true. And those holistic methods seem to work with the body in a supportive way, whereas pharmaceuticals kind of override the body's natural processes, which sometimes you have to do, right?
Sure.
But in general, I always think it's better to support the body's natural healing mechanisms than create chaos. So you had mentioned before a couple times liability issues. So I know with humans, all vaccine administrators, doctors, nurses, pharmacists, everyone who gives vaccines benefits from the NCVIA liability shielding of 1986, which means they're not culpable or held liable in any way. But I know for veterinarians, that's different. Can you tell us a little bit about those differences in liability?
Yeah, so really, we don't have any liability shield and protection, which is kind of interesting, isn't it? That the human doctors do, and there's a whole history that your website, your group has talked about with that. Interestingly, though, I actually asked, as a side note, during COVID, I was not the most popular person on our Texas Vet email list group because I obviously had a different perspective. But I would ask them, if all these vaccines are so safe, why do the vaccine manufacturers need liability protection? And their products we were forced to take them. If they're safe, why do you need liability protection? And one person said, well, if they didn't have liability protection, they were going to stop making vaccines. Like, well, yeah, I know the history, but why would you stop making vaccines if they're safe? Well, they were going to get sued, but sued for what? They're safe. And again, they would never respond to me on that. They just had their standard. So, we have liability. Now, again, people need to understand, if I give a pet a vaccine and it drops over dead, more than likely I would not lose a lawsuit because there are side effects of everything we do. Death is a side effect. Now, if I vaccinate a pet that shouldn't have a vaccine, or I gave it, quote unquote, too high of a dose, maybe 5 vaccines at once. Okay, those are other issues. But in and of itself, the vaccine, yes, it has side effects. Death is one of them. It's very, very rare if you're following proper protocol. So I don't really worry about the liability protection for that, or liability non-protection for that. I know the human doctors, they lucked out because people are paying other people to pass various laws. But it'd be nice if we could get away from that and just let vaccines stand or fall on their own. And if you want a vaccine, like I said, I'm not against people getting vaccines. Just don't force me to get one. And if you want one and you feel good about it, I'm okay with that.
Yeah, it's Texans for Vaccine Choice. You can get as many or as few vaccines as you desire. But, mandates and force have no place in a free society.
Right.
I think it's interesting that you'd said you could possibly face a liability issue if you were to give, say, 5 vaccines at once when, 5 to 8 vaccines for humans at a time is routine. Like, I think that's...
So if I'm giving 5 of the same shots, I would give 5 distemper.
Oh, okay.
most of the vaccines vets give, there's 3, 4, 5, or 7 things in the one shot. Similar to what you were talking about with kids.
Humans.
Actually, we'll get multiple injections too.
Mm-hmm.
Again, as I studied during COVID, when they talked about various studies, and people need to understand, this is probably a good point. I know y'all bring this out, but for people listening for the first time, when you look at the way the law allows vaccines to be tested, they have to test it against a placebo. All of us think, well, the placebo is sterile water. Of course, it's like, no, the placebo could be last year's vaccine that caused 100 side effects. This year's new and improved vaccine only caused 102. So it wasn't no worse than placebo. The placebo was bad anyway. So you have to kind of understand that. And there are no studies in people or pets to show what is the safest maximum number of shots, number of antigens we should give at one time. We don't know that because it's not been tested. So we're just kind of guessing, well, you're here, let's just give 5 or 7 or 20 so you don't have to make 20 trips next month. So all done for convenience of the mom or the dad or the pet owner, which again, I understand convenience, but we don't want to cause problems because of convenience.
Yeah, safety matters.
Right. It should.
Yeah.
Above all,
safety matters.
That's my mom.
Yeah, especially when you're the recipient. I meet people all the time who have that misconception about vaccine safety testing. I always describe it as like, well, what vaccines are doing is the Tide Pod versus Cascade Pod safety challenge, where one group has a Tide Pod, one group has a Cascade Pod. If the rate of injury is similar between the two, the pods are declared safe. But that's not really a valid safety trial because both of those things are toxic. Yeah. And when you look at vaccines, you've got, pneumococcal pneumonia. We've got PCV20 that was tested against PCV13. PCV13 was tested against PCV7, And same thing with MMR. And like some of them didn't even have a control group, like hepatitis B and IPV didn't even have a control group. Or just an observation study.
Yeah, the same with COVID vaccines. They came out with new variants, and it's like, well, we don't need to test them because it's the same platform. It's like, there's still something different.
There's still something different, right? And human and animal biochemistry is very complex.
Right, and we don't even understand a lot of it. So
we don't understand.
We need to be careful. Again, our motto is above all, do no harm. And we just need to understand there's a harm with doing vaccines. There's a harm with not doing vaccines. And you have to know your risk. If you're living a promiscuous lifestyle where you're going to get infected with all sorts of things, okay, well, first of all, you probably should change your lifestyle and not relying upon a shot. But if you're going to get a shot, at least you're putting yourself at risk for the lifestyle. So maybe you're going to get more protection than someone that's not going to be at risk at all. Same with your pet. No, I know you want to talk about rabies. Is this a good time to bring that up since that's
Yes, bring up the rabies, please.
Okay. So rabies is a legal thing as well as medical. It's the only shot vaccine your pet's required to get. So let's talk about rabies. In the state of Texas, and this varies by state, but in Texas, you have to get your pet vaccinated for rabies, usually between 3 to 4 months of age, a booster a year or so later, then a booster every 1 or 3 years. And what determines the 1 or 3 years is, what does the label of the rabies vaccine say? Is it a 1-year label vaccine or a 3-year? The concern is the 1-year and 3-year vaccine are the same shot. The only difference is what did the label say. So my 3-year shot was not 3-year vaccine was not 3 times more potent than a 1-year. It's the exact same. It'll produce the exact same titer. It's no big deal. So if you're taking your pet to a veterinary now that's doing a yearly vaccine, just keep in mind you're getting a 3-year shot every year. So you might ask for a 3-year shot or try to find a doctor that does a 3-year shot. Now, people have asked about rabies titers. And again, I'm not the veterinarian that's going to force your pet to get a shot. I've heard too many horror stories of people going to the vet. They take their pet to the back to do some blood tests. And, oh, by the way, we gave your pet his vaccine when he was back where he was due for him. These owners are like, I never told you to do that. Well, we did it anyway. To me, that's malpractice. What I'm doing is not malpractice. And again, I told the state board and they were okay with this. If you really don't want a rabies shot, and you want a rabies titer test, we will do those. The titers are valid. They're great. They're required for international travel for pets. So we know they're good because the USDA makes you do that. Other countries make you do that. If you're going to Hawaii, I think you still have to do it there since they're an island. So the titers are very effective. The problem is the state of Texas will not accept a titer test. I've talked to the powers that be. I talked to the Animal Health Commission. They understand my concern. There's a lot of politics behind it. So, if you find out who your legislators are, maybe try to get the conversation started. Realize there's a lot of opposition to this. We're also on the border with Mexico, and we do have rabies coming across the border with animals. We do have tuberculosis coming across the border with illegal aliens and probably even legal people, because there's a difference in healthcare in both places. But the titer test, I would have an owner sign a form, just like with the reduced dose vaccine form. And they would basically say, I understand I'm supposed to get a rabies shot. Dr. Shawn has told me about this. I understand by law I'm supposed to do it. I'm opting to do a rabies titer test, and I understand that the state of Texas does not accept my results. So owners that didn't want a rabies shot would sometimes do this, and they just wanted the knowledge, is my pet still protected? If it was titer came back high or normal, your pet's still protected medically, but I would tell them, if your pet bites someone, they're not vaccinated. Yes, they're immunized, but the state doesn't care about that. They're not vaccinated, and there are some liability issues on your part. I'm fine because I had you sign a form saying you're supposed to do it. So it's just, again, you're probably not going to find any vets out there that are going to let you sign a form. It's going to be a personal decision. Now, again, medically, I've never seen rabies in my life. I probably was more likely to see it when I was in vet school, and we had to get rabies shots ourselves, which, again, fine. I could be exposed. I don't want to die. It's a fatal disease. I was okay with that. But I've never seen that in my practice. Rabies is out there. It's in Texas. We have bats. We have skunks. We have raccoons. We have possums. We have all this. But unless your pet is bitten by a rabid animal and then bites you, or you're bitten by a rabid animal, you're not going to get rabies. That's how it's transmitted. So again, owners just need to make a decision. I always tell my owners, you're supposed to follow the law. This is what the law says. Medically, your pet has cancer. Don't do any more vaccines. Medically, your pet has chronic seizures. Don't do any more vaccines. But by law, you're supposed to do rabies. What do you want me to do? That would leave it up to them. Because we know if you vaccinate during illness, number one, the vaccine may not immunize you, may not work. Then the illness could get worse. The cancer could come back. I saw so many pets with cancer that would come to my office, and I would say, okay, please don't vaccinate your pet anymore. And they're like, oh, we did the vaccine last month and got cancer the last few weeks. It's like, I can't tell you the vaccine caused it, but the vaccine didn't help and may have unmasked a cancer that was kind of growing and fulminating. So again, rabies vaccine is just a different animal. You have to make your own decisions, talk with your vet, and do what you need to do.
We have lots of volunteers and supporters who are trying to drum up legislative support to change the laws to at least allow for titers, and exemptions, because it's really wild how with so much medical liberty here in Texas, our dogs in particular are held captive by this rabies law because it doesn't accept titers and it doesn't accept exemptions, even though, as you said, there are real, true contraindications to continued vaccination. Right. What would you recommend those, volunteers and supporters? What arguments would you say are the strongest with talking to legislators about this topic? Do you have any advice?
Yeah, one thing I would share with you and Rebecca, because you have more legislative contact than I have with anybody, because y'all are always in Austin, fighting for vaccine freedom, which we all appreciate. But if you have the ear of legislators that are open to the discussion, feel free to give them my contact information, because I can give them a perspective you can't, since I'm a veterinarian. Right. Let them know this. All I can say is, if you have vaccine-friendly, healthcare-friendly, choice-friendly legislators that you can contact. And again, you can go to Texans for Vaccine Choice, reach out to them if they have people that want you to contact. The main arguments would be that titers are effective and they show that pets are protected. We need to make rational decisions that, not every pet needs every vaccine. If you've got an older pet, if it's got an illness, if your veterinarian could write a rabies exemption for these things. And there is always a little risk. So, you don't want to get a vaccine exemption if your dog lives on a 100-acre farm and there are wild animals running around, because that dog is at a risk. If you do the vaccine every 3 years, you're at least lowering the risk, but you could do titers and maybe push it to 4 or 5 years. We also have a study that was done by one of my mentors, Dr. Gene Dodds. You can go on the internet, look up Dr. Gene Dodds or Rabies Challenge study. She used 2 specific brands of vaccine. One's not effective in America. The other one was MRAB3, which is what I used, the non-adjuvant, the mercury-free, that's the aerosol-free version. And she showed, I believe, don't quote me for this, but I believe 100% of the pets who were vaccinated for rabies and then challenged. They were given rabies virus to see if it was going to kill them. It sounds horrible, but that's what you have to do to prove things work. And I believe at 5 years, there was 100% protection. Now to 7 years, about 80% of the pets did not develop rabies. So I would think if you had a 3-year vaccine, titer right after that, and then titer annually, and just see if the titer is starting to fall, maybe you would have to have a vaccine at a certain titer level. So it can be a little complicated when you write these laws, but I think titering, switching to the 3-year vaccine, which you're doing anyway, as I mentioned, if you're giving it every year.
Yeah, I didn't know that it was the exact same.
Well, I think one thing they should do is just totally get rid of 1-year vaccine to go to 3 years, because you're doing the same thing anyway. And that would be, I think, a very easy thing to get rid of. That shouldn't be controversial, unless vets are saying, well, we won't make any money if people don't come every year. Well, you can go to your vet every year anyway, or twice a year for checkups, for blood tests.
Yeah.
Vaccines are not all of healthcare. Most of my patients would die of cancer, kidney failure, liver failure, heart failure, thyroid disease, not distemper, not rabies. I rarely saw that. I never saw rabies. So I think we need to have a common sense approach. But again, if you reach out to Texans for Vaccines Choice and can get certain legislators that are very friendly. I know you have a voter guide that I get in my email all the time.
Yeah.
Reach out to those people and just say, hey, can we start a conversation? If you want a vet perspective, reach out to Dr. Shawn. I'll talk to them anytime. I'll even go to Austin if I need to do that, if that's a topic that we need to discuss. But I can certainly talk on the phone because that's easy to do.
We're definitely doing our best to set things up, because we've tried in the past to get legislation introduced at least, but we haven't been able to find a legislator that was willing to introduce and sponsor that legislation. So we're still in that very beginning stages.
What kind of opposition did you hear from the legislators you reached out to?
The biggest opposition was a lack of awareness about rabies side effects and injuries, a lack of empathy or caring about the animals being injured, and a hyper focus on trying to protect the human children and the humans, and kind of just forgetting about the animals. I mean, mainly the biggest thing was just a lack of empathy and a lack of awareness.
Sure. I think you can protect humans, again, going to every 3 years by law and get rid of the 1-year thing. You can protect them with tigers. You mentioned something else, though. What was it? Just slipped my mind. What were the 3 things you said that you were having trouble with?
Lack of empathy, lack of awareness.
Okay. So here's what I wanted to say. So what I would say is, I always like to ask the question, why do I need a vaccine? Why does my pet need a vaccine? What's the point of it? And if we can show that the titers show the pet still immunized, and reference again the vaccine, the rabies challenge study, there has to be a reason to put a vaccine in your body or your pet's body. I understand, and I would tell owners, look, you're not vaccinating your pet for rabies because we care about your pet. We care about you. And that's really why we vaccinate pets for rabies. I need to say this. No one cares about your dog or cat. No, obviously I do. And I don't mean to be blunt, but that's why we have that. That's why children are vaccinated for measles, because we're worried about the pregnant woman, not about the kid getting measles who's probably going to recover fine. That's just the reality of the science behind the disease. But even though we say the rabies vaccine isn't for your pet, it still stops that transmission to people. But does it have to be given every 3 years? Well, the answer is no. What's a more rational approach that can still protect all of us and protect your pet and reduce side effects from the vaccine? And again, I understand that sometimes it's hard to prove cause and effect with some of these vaccines. What I can tell you is in my practice, when I went holistic, I saw very, very few pets with horrible cancers and immune problems. I still saw them, but they were coming from other practices and they were over-vaccinated. So can I prove cause and effect? Well, I don't think I have to prove it for my own liking. I saw it in my practice. And common sense says that there's different populations and how people and pets are reacting based upon their diet, environment, and vaccines. I don't know a study I can do to prove that, but I can still say, well, it may not be causation, but correlation is good enough for me, and I'm willing to settle for that.
Right. Yeah. So you're saying that you've definitely noticed a correlation between hypervaccination and cancers, because that whole problem exists in humans too. You can look at the disease curves and the trends, and as the vaccine dosages go up, so do the autoimmune diseases and the cancers, almost in parallel.
Right. And a lot of times they occur within a month or two of the vaccine, same as in people. So, we know these things are not totally necessary as much as we're doing them. I know when I first started, I saw a lot of allergic pets, and I would tell them, okay, please don't go to another vet and get shots. And sometimes they would forget, or they lived a distance away and they'd come back a year or two later. Oh, the pet's skin is bad again. Well, what did you do? Well, we're getting his vaccines. It's like, no, I told you, I just spent all your money and got your pet better. Now we got to start from scratch. Don't do that. So, we just do the best we can and try to educate people.
Yeah. Well, I, for one, am so appreciative of the work that you're doing in the world. It's a huge hole in veterinary medicine, and it's so refreshing to hear this perspective and to be validated for all the holistic care. I cook for my dogs. I get supplements. Like there's so many conscientious pet owners that are being invalidated by their doctors who are still very much in a allopathic mindset. So I really appreciate the different perspective that you're bringing and all the knowledge about how to help heal your animal and keep them healthy the longest that you can through supportive natural methods. Is there anything else that you'd like to share with our audience before we end today?
Well, just do some research before your pet has to go to a veterinarian. If you can try to find people that are open to it, that won't treat you poorly, just like, again, finding a doctor. If you do find veterinarians that are more open to this, it'd be great if you could let Texans for Vaccines Choice know so they can add that to their database as well. Like I said, I'm not in private practice anymore, but I know they'll put a link to my new website if you need to consult. If your pet has a disease, you want to talk more about wellness, and I can explain these things in more depth. If you do titer testing and your vet maybe doesn't understand how to interpret it, I can help with that as well. But otherwise, I think we had a really good discussion. We talked about so many things. Just be open to the idea. I know people watching this are going to be open to it. Their eyes will probably be open to a lot of things they didn't know. But keep in mind that you do have choices. We really should be more in control of our healthcare for our pets and ourselves. And if you can try to help Texans for Vaccines Choice reach out to some of the legislators, the more they hear from people, the better.
Yes.
And we'll all do what we can just to let them know. But you want to come from a positive perspective, not just yelling, screaming, and negative. Give them some of the science. You can do some of this research yourself. You can look at the Rabies Challenge site. You can give them information they can read, and their eyes will start to be open. And then once that happens, we can continue the conversation even more.
Absolutely. It's so important, the approach that you take in your communication. Like we actually at Texans for Vaccine Choice, we have a whole communications course designed specifically for advocates to help them have that challenging, tricky conversation with love and results, because you want that person to maintain receptivity to you and to be willing to continue to learn from you in the future. You don't want to go and go nuclear and then they don't want to talk to you. And then every person that represents your cause is crazy to them.
Right.
You want them to be able
You'll set the movement back a long time. I mean, you'll set everything back years if you mess things up.
Yes. So I have had to clean up many a sloppy advocate's mess in my day and work even harder to get that person to be willing to be receptive to what I have to say. So if you're struggling with that, if you have a hard time, know that TFVC is here to help you with that also, because that is a crucial part of advocacy of any type of cause, is your ability to communicate well and connect well with the person in front of you on these challenging topics that do have so much, almost religious fervor of it in the ideology around it, like this really intense ideological belief that's not based necessarily in facts.
I agree.
So I appreciate you so much, Dr. Messonnier. It has been wonderful spending time with you. I think it's hilarious that I've had your book on my bookshelf for a while now. I never put two and two together until just now when I saw the book on the title. I love that book. I have used the information in it to help my dogs for a good long while now, and it has always worked.
Well, I appreciate that. I'm glad you got some useful information out of it.
Oh, absolutely. It's blowing my mind. Like, I'm actually getting to talk to you. This is so exciting for me.
Thanks a lot.
Yeah, I appreciate you so much. Thank you to my audience for being willing to listen. This has been another engaging episode of Shot Callers, and I will see you next time. Thank you for listening.
Thank you for listening to the Shot Callers podcast. Please, If you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the shot callers.